Have you recently been told that you got osteoarthritis, or you recently found out that you've been getting knee joint pain and you're not sure what to do about it, or you potentially might have been seeing a surgeon and told that you got bone on bone and you need to go for a surgery and you just don't want to do that? That's fine. Keep on watching and I'll answer some of your questions. So, who am I? Why listen to me? My name is Stephanie and I'm a physiotherapist based in Head to Toe Wellness Solution. And ever since I graduated and started working for a few years, I've seen so many people with osteoarthritis come through these doors. I've seen how common it is and how debilitating it is for my clients. So I decided to undertake a few more courses in osteoarthritis and do some personal research of the literature out there, so that way I can come and present to you guys the best available management plan in terms of managing this condition. Arthritis is simply any structural changes that happen in the joint and that's associated with pain. Osteoarthritis is just the most common form of this, where there's inflammation of the bone underneath the cartilage in that joint cushioning space. Typically, most people say they have swelling, pain in the joint, especially the knee and hip, and also potentially some crunchy sound and stiffness as well. It can actually affect all joints of the body instead of just the knee and hip, but those are the most common as well. So along with working with your physiotherapist on coming up with a plan to improve your health, the other thing that you can start doing right now to help you get out of that knee or hip pain is exercising. Now, you might have been told in the past, oh, I got wear and tear or bone on bone, and if I use my joints more, it's going to get more damage and therefore I'm going to be in pain. But no, that is no longer true. Exercise is actually going to help strengthen the joint, and it's actually going to help you improve your function, get you doing the stuff you love doing easier, and also help you be in less pain. But the most important thing with exercise is it needs to be tailored and suited to you as well. So what are these things that you can change right now? The biggest kicker is that nobody's the same. Everybody is different when they have osteoarthritis. And so therefore it's important you do not compare yourself to the next person, because everyone has their own journey and they need their own individualized and tailored plan to help them get out of pain. The best thing to do is to see your physiotherapist, who can then comprehensively assess you in all the important domains of your health and work out where things might be potentially lacking a bit, or we can see improvement in to get you out of that knee or hip pain. The most important thing to understand about osteoarthritis that have changed over time is that we now see it as a whole person condition. So think of diabetes, very similar to this. But what is the most important about knowing this now? It simply means that the structure itself alone is not the main reason causing your pain. So this means if you were to go for a surgery right now and get that structural changes happening, you might not be completely out of pain. But on the flip side of this, I want you to look at the positive. This means that it's a whole multitude of things affecting your whole health that you can do to yourself right now to help yourself get out of pain, which is exciting. Another fantastic thing about these exercises is that they suit anybody of any age and any level of ability. So too many people I've seen have told me, oh, I can't exercise because I'm in too much pain. And that's very true. I've seen it. It's very difficult for you to stand. It's very difficult for you to move or walk. But that's okay. We can start at a very low level, and pretty much all of our exercises that we do will have a very basic component to it, which we can slowly progress up to each individual. And the biggest thing to know is that no one person is the same. Everyone has their own individual journey and their own background, as well as all those domains that I've talked about in the past. They're all on different levels, and we have to make sure it's tailored to you specifically when it comes to your exercises and your plan to get better. And the coolest thing about exercise is there's no side effects that potentially a surgery or even injection can have as well. and it's simply a win-win situation to do. Let's say, for example, you wanted to do an exercise program and you might have a surgery appointment upcoming. If you do the exercise program, focus on loading up your knee and getting you moving in the best way possible, you might be able to get out of pain enough where you're able to delay that surgery. And that's amazing if that happens. Let's say you're still in a little bit of pain after doing a few months of exercises, ideally at least 3 months. That's completely fine. You go for your surgery, you will know that your knee or hip, the muscles around there, are in the best condition possible for you after the surgery, and that will help optimize and give you the best surgical outcome. And so it's simply a win-win situation doing exercises. Now, if any of this is sounding really interesting to you, you're more interested to get a comprehensive assessment and come up with a plan on how to get you out of that knee or hip osteoarthritis pain, or you're interested in doing exercises, feel free to just click here to find out more. Thank you for listening. I'll see you soon.